Welcome everyone. We'll just wait as people are joining us for the webinar on your safety as a volunteer during COVID-19. So we'll just give it a couple of minutes because we are expecting quite a few attendees. Everybody's muted, so when you're attending, just for the people putting some comments in the chat box, when it's a webinar, everybody's muted. So everybody, you shouldn't, the only icons and things you could see when you're a webinar attendee is the Q&A and the chat box at the screen. It's different if you haven't previously attended a webinar via Zoom. It's different to a meeting. So you can access the chat box and you can access Q&A. The other thing I should say is when you do access the chat box, if you're wanting it to be a comment just directed to Rachel and myself, select all panelists. But if you're looking at it being for everybody to see, then you click all panelists and attendees when you see the to button and the drop down button next to that. We're just going to give it maybe 1 or 2 more minutes as we're just expecting a couple more people. What we will ask everybody is that you put questions directly in the Q&A box, as sometimes they can get lost in the chat box if people are asking, you know, or making comments. So we will be, thanks everyone. It doesn't matter, hopefully you can all just hear it, but you won't be able to interact verbally with us because it is a webinar. So anyone that's new or hasn't attended a webinar before via Zoom, you will only hear Rachel and myself speaking today. That's why we encourage you to use the Q&A for questions, and the chat box is perhaps more general, but we'll just give it maybe 1 more minute, so we'll get started at 5 past. Hi Louise, hi everyone. Yes. So I think we'll get started. I think that should be enough time. And if people join in as we go, that's not a problem at all. I will let you know we are recording this, so it will be going onto our website for people to access should they miss anything. So we'll get started and we'll get going. But firstly, welcome everyone to today's webinar. This one is called Volunteering, Your Safety as a Volunteer During COVID-19. So today you will have myself, Emily Zesers, the Client Relationships Manager from Volunteering SA&NT, based here in Adelaide as one of the facilitators, and also Rachael Bowker, our Executive Manager in the Northern Territory, as well as your facilitators. We encourage you to ask questions. As mentioned before, please use the Q&A box at the bottom of your screen, and the chat box. You can introduce yourself, or if there's anything you wanted to share with other people. And just a reminder that you can click all attendees and panelists when you are putting that information into the chat box. That would be great. Rachael, did you want to add anything around your introduction?
No, just hello and welcome everyone. I just had to quickly duck off and give someone the webinar link. Sorry about that. No, but welcome and thank you for joining us today.
Yes, that's right. Thank you. And so this session is really directed for you as volunteers. We've been, just to inform you, we have been running sessions like this or something similar for volunteer involving organisations and what they need to consider as they're reigniting their programs during the COVID pandemic. But today it's really focusing on you as the volunteer. So firstly, we want to acknowledge the traditional owners of the country throughout Australia, in which we're all meeting here today, and recognise their continuing connection to land, waters and culture. We pay our respects to the elders past, present and emerging. And the reason we've done that is because today we have people from obviously both the Northern Territory and South Australia and beyond, and we want to pay our respects to the elders wherever we may be meeting to here today. So, as I mentioned, it's a webinar. The Q&A is the option for asking questions, and the chat box should you wish to introduce yourself. So, let's get started. Obviously, we just want to acknowledge that this has been a really difficult time for people. It has been something that I guess a lot of us have never experienced or seen before. And so whilst this has been a real challenge for you as a volunteer, it's also been very challenging for volunteer involving organisations. And I just want to acknowledge that it's been a learning curve for everyone. And we have started receiving some queries from people saying, we're not allowed to go back yet and volunteer, or, you know, we want to be doing this. But we want you to know that we're working with a lot of organisations and they're doing their best to try and make sure they're putting in the policies and procedures and the right safety guidelines before things go back to either previously or what we're calling the new normal, or also the next step in the situation. So today we're going to be focusing on safety guidelines, your rights and responsibilities as a volunteer, looking at formal versus informal volunteering, and your wellbeing, and how to stay connected when things like volunteering are put on hold, because we know for a number of people volunteering is actually one of their main social connections and social activities for engaging beyond your own sort of walls of your home. So firstly, and I will also add that we will be sharing resources with those of you who have attended today. So we'll be emailing out some of the documents that we discuss. So you will get access and a copy of that. For now, we'll be talking you through some steps and some good practice guidelines for volunteers that are volunteering during COVID. So firstly, your safety is the #1 priority. So before considering volunteering or recommencing volunteering, ask yourself, am I well enough to volunteer? And really consider your own health and the risk management around that before you commence volunteering. Don't put yourself or others at risk, and make sure you're following all the guidelines for infection control around hand washing and social distancing. And I should also state that Rachael and I, we are not lawyers, and we do have based a lot of our information today on a number of resources. And also, we really encourage you that you need to be following the advice from the Australian government and from the Northern Territory government, and also the South Australian government as well, before you make any decisions. So your safety comes first. It's really okay for you to put your volunteering on hold right now and to say, no, I'm not ready to come back yet. Organisations are understanding of this, and we're hoping they are, and we're encouraging them to understand that there may be some shortages and what to do in that sort of space, but it's okay to put your volunteering on hold if you're not comfortable or ready to go back yet. So as I said, your safety is your number one priority. And from that, it's around communicating that with your organisation and with your volunteer manager or coordinator to let them know that you're not ready, or to start asking those questions. And we'll get into what some of those questions will be. Number two, you really need to think, and like I mentioned, familiarise yourself with the most up-to-date requirements and advice from all of the governments I've mentioned. And the other thing is to consider that things are changing now and restrictions are easing. However, there is talk about a second wave. So whilst things might be easing for now, we need to all be thinking that this is the normal as each week or each day comes, because things are changing quite rapidly and we need to prepare for that and keep that in mind. So you've got your Australian Government Department of Health, your Northern Territory Health, your South Australian Health, and you've got COVID websites from both the Northern Territory and South Australian governments that you can access that up-to-date information. I'm now going to hand over to Rachel, who's going to talk to you a bit about informal versus formal volunteering.
Now, just before I'm going to stop sharing our screen for a second. In the chat box, just so Emily and I get a little bit of an idea, do you want to put down whether you are a volunteer or you haven't volunteered before, or you've been volunteering, just so we can have a bit of an idea about, what people are doing in terms of volunteering. So the difference between, I guess there's two types of volunteering that we talk about during COVID-19. There is formal volunteering, which is sort of classified as you're volunteering with an organisation, a volunteering involving organisation, such as things like museums, community service organisations, schools, faith-based, aged care, environment, animals, the list goes on and on and on. So that is with an organisation, and your volunteering is quite structured. So you have a volunteer coordinator that you respond to, you have policies and procedures in place that govern how you volunteer. The other type of volunteering that we've seen a lot during the pandemic is informal volunteering. And that is just people coming together in their local community to help each other and help those who are older or isolated or vulnerable and at risk. You may have seen them on Facebook, you may have seen them through social media, people, offering to go and help their neighbours with shopping and things like that. This informal volunteering happens all the time in our communities. It sort of goes under the radar a lot because people don't really, talk about it, they just sort of do it. But during the pandemic, it certainly did come out as something that people were really keen on doing. So that's the two sort of types of volunteering. So just looking at it, I think we've got lots of volunteers. We've got volunteer coordinators, and we've got Kathy from the Catherine Show. We've got lots of people saying that they do formal volunteering for different organisations. We've got lots of different people, lots of formal volunteering. It's fantastic.
We've got a combination of both the Northern Territory and South Australia, which is great.
Yeah, absolutely. So I'm going to share my screen again just so we can go back to what's the difference. So I guess that's the main difference though when we talk about that the formal and informal volunteering. So they both happen, and we want to make sure as volunteers that we're safe, either whether it's informal or formal. So my screen's not going to move. Oh, there it goes. Oh. Sorry. So formal volunteering I'm going to touch on first and have a quick chat about that. So when you are, whether you're a current volunteer or you're thinking of starting to volunteer, what we are asking volunteers is to ask their organisation that they want to volunteer with, or they currently hold with, or they haven't started back yet with, is, does your organisation have COVID safety guidelines? So that those guidelines are basically basically a guideline on how they're going to keep you safe. How are they going to put all the restrictions into your volunteer role? So, for example, if you work in a op shop sorting donations, how are they going to keep you safe with handling things like that? So there has to be some sort of way that you can wash your hands and disinfect your hands. If you're working with high risk, vulnerable people, clients, so doing things like Meals on Wheels, how's the organisation going to keep you safe? How are they going to keep their clients safe? So you need to see some sort of safety guidelines so that you know that they are taking your safety seriously and they're putting procedures in place to keep you safe. And even things like the 1.5 metre social distance, how's that going to work in your volunteer role? So they're the conversations you should be having with your volunteer managers. Whether you're a prospective volunteer and you haven't started yet, or you're a current volunteer waiting to go back. These are the conversations we are encouraging people to have with their volunteer coordinators. The next thing we ask, and this is current volunteers and new volunteers should ask this question, does the organisation have volunteer insurance to cover your volunteering? So all organisations are strongly encouraged to make sure that they have what we call, is it volunteer accident insurance, Emily? Is that what it's called?
Sometimes be referred to as either voluntary workers insurance or volunteer personal accident insurance. So sometimes you might see a slight variation in what it's called, but you want to know that your organisation has that, and best practice suggests organisations have that in place.
That's right. And so that insurance will cover, so if you fall down and hurt yourself while you're at your volunteer role, and you can't go to your paid role, or it's going to impact you physically or some way, it covers you with their insurance. And it's really important that organisations think about having that for their volunteers. And it's a really important question for you as volunteers to ask the question about, do you have volunteer insurance to cover me so that I am safe? The next thing we're encouraging people to maybe not and ask this question tactfully, but we don't want volunteers to be doing the work. If organisations have stood staff down and they need volunteers to fill those roles now, that's not the role of a volunteer. Volunteers aren't there to replace paid staff. So making sure that it's really clear about what your volunteer role is, what the role is, make sure it's got a position description with it or some sort of task list with it, so you clearly know what your role as a volunteer in that organisation is. And the last point that all volunteers should receive is some sort of orientation or induction to that organisation, training on how to do that role and feedback about how you're going. And that's a two-way street, feedback for the organisation and feedback for you as well as the volunteer. So it's really important you have a contact person that you can talk to within the organisation, that you can raise concerns with and speak to. Is there anything else, Emily, you want to add to that?
Just a reminder again that volunteering shouldn't really exceed 15 to 16 hours a week in one organisation when we are considering if it is a volunteer role or a role of a paid staff member. Obviously, sometimes when organisations are made up of all volunteers, that may not be possible. We do know people volunteering multiple hours, but if your organisation has paid staff members, we strongly encourage that it's, you only be doing a maximum of 15 to 16 hours a week as a volunteer. And a reminder that any organisation you're volunteering for, if they are or have one paid staff member, that work health and safety legislation is then applicable to you as volunteers within that organisation as well. So I'll continue on now with the few other things to consider when volunteering for an organisation.
Hang on, wait 5 seconds. Sorry, Emily, just to jump in before you do that. Do you want to just, oh no, you go, sorry. Sorry, you go. I don't know what I'm doing.
We're still navigating the joys of running online. Thanks, everyone. We can talk about volunteer responsibilities as well.
We will, yeah. You do that.
Yeah. Just a reminder that, you know, when you're communicating with the organisation, that you have clear contact details of the main contact person. So if it's your volunteer manager, if it's the HR or a volunteer coordinator, and who it is that you can raise any questions or concerns with and liaise directly with, and make sure your contact details are up to date. It's also not a bad thing to ask how our organisation is going to continue contacting you or communicating with you during this time of perhaps isolation or the volunteering involvement being put on hold. So are they sending you newsletters or group email chats, inviting you to online Zoom meetings? At Volunteering SA&NT, we do an sort of either an afternoon tea or a morning tea, or once a month where all of our volunteers are invited to be involved, and we continue to send out information and communicate with them. So don't be afraid to ask how you're going to maintain that communication with us, especially if you've been a long-standing volunteer and you're really dedicated and committed. We hope to see that those organisations will maintain that level with you, because they don't want to lose you and they don't want to see you go somewhere else. Again, as a reminder, do not volunteer if you're feeling sick. And also, as Rachel said, ensure that they have a policy and that plan in place. So a lot of organisations are now putting into place a pandemic policy. So see if they've got one there as well. And remember to communicate yourself. So you, as Rachel and we'll go into now, have responsibilities. So I'll hand back over to you, Rach, to talk through those responsibilities.
Thank you. Sorry about that before. The thing as a volunteer, and I guess this is whether you're informal or a formal volunteer, and we have a handout on all the volunteer responsibilities and rights as a volunteer, but make sure you're always punctual and respectful of others. Tell them when something is wrong or something isn't working. Undertake any training that is needed and carry out the role as agreed. They're pretty basic, but the handout has a lot more information in it that we will have there. But it is important that, you know, if we take on a role as a volunteer, that we try and do the best we can to undertake that role.
And really just that reminder that whilst you might be willing and keen and eager to get back out and volunteer, the organisations are trying to do their best to put some of that stuff in around your safety, because at the end of the day, they don't want to be liable should you contract COVID or come down unwell. So remember that those organisations, if they're saying we're not back or we're not ready yet, please do be patient and understanding, because like I mentioned earlier, this really is a new space navigating for everyone. But, you know, in the case of you wanting to really volunteer urgently, we do always encourage people to have a look at our website, as there are often volunteer involving organisations. And this opportunity, as you'll see on the screen, informal volunteering. So what can you do if your volunteering's gone on hold, and how can you help members in your community? So the first and easiest way really is to reach out to family, friends and neighbours. So really you can let them know that you're there to help, and you might have already been doing this. I know we're a few months into dealing with this now, but you can keep doing it. There's definitely people that are at higher risk that are choosing not to go back into mainstream society just yet, or expose themselves in the supermarket. So consider how you approach people. You may not have even met some of your neighbours before, and some people may not have even had visitors at their door for weeks on end. So perhaps, you know, it's a knock on the door, or it might be writing a short note to introduce yourself, including your name, your phone number, and let them know that you're only a phone call away. Again, a reminder, don't offer any assistance if you yourself are sick, because really remember our priority is to stop the spread of the pandemic. Don't enter people's homes unless it's absolutely necessary. So phone or text them to let them know you're at the door, and always practice those hygiene principles and distancing guidelines. So I've seen my neighbours where one of them leaves a certain coloured shopping bag and they put the list on their front door. And so I was watching the other neighbour go and collect that and takes it and then returns it back to the house. So there's little ways, or, you know, really important ways we can help people within our community if our current formal volunteering has ceased for the meantime. Remember, you really are responsible for your own self-care. So set boundaries and avoid burnout. So take regular breaks between activity, and that looking after yourself should be a priority. So it's great, we all want to help and give back to our communities, but remember, we also do have to look after our own health at this time. And it is winter, and for those in Adelaide, it's very freezing at the moment, and we know we can be at higher risk of other colds and flus, not just COVID-19 during this time as well. So how to protect yourself when it comes to informal volunteering. So really, the other thing to think about is avoid situations that involve gathering too much information about vulnerable people. Don't enter the homes of people who are potentially vulnerable. And think creatively, as I mentioned, about how to get those shopping lists. So it might be on the door and leaving things on the doorstep, and it might be via text messaging or email that you might be able to do that. And avoid exchanging and handing money. So it might be, you need to be careful when we're looking at bank accounts and things like that. And also for those around you or for yourselves, remember not to be giving out any of that information to anyone you don't know or aren't comfortable with, or any strangers. So take care of yourself and maybe keep receipts. And it might even be that, if you're asking someone to go to Coles, that you might have been able to get a Coles voucher, so you know that it's only going to be used in Coles and relevant and spent on that. So you also want to protect yourself in that case if you're informal volunteering. We don't want to see anyone putting themselves at risk potentially for health and or any financial issues as well. And confidentiality is important. You don't need to be out there sharing or posting on social media or showing on Instagram how who or how you've been helping. You might be able to celebrate and encourage people to think about informal volunteering, but to do it safely. And again, keep your distance and remember the 1.5 metre rule as well. So some tips around that really for you to think about when it comes to informal volunteering. But I'm going to hand back to Rachel again now to chat a little bit more about that as well.
So just four important we just want to raise four important things to consider if you are doing informal volunteering. The first one is probably not so great an issue now because the restrictions are lifting, but traveling around, and visiting people and things like that. So think about how that looks and how it looks. Make sure you're staying within the guidelines, especially if you're going into communities in the NT where it's remote communities or closed off communities. Make sure that you've got authorization to do that. Safety and security. Your personal and others' safety and security you need to consider, because if you're entering, or we're saying don't enter people's homes, but if you're interacting with people you've not met, you don't know them, they don't know you. So be really clear about your own safety and the other person's safety, and make sure everything's really transparent and everyone knows what you're doing and it's documented. So just in case something happens, you know that you've done the right thing and you've covered yourself. Remember, when you're doing informal volunteering, there's no insurance. So if something happens or you hurt yourself or you're hurt, there's no insurance to cover you on that. So just something to be aware of. There is no solution for that at this point in time. It is just one of the things to think about. And the last one is how you're sharing the information that you're doing. You're helping people, doing that on social media, or how you share that information. Just make sure you protect yourself and your own information you're putting out there, and you're protecting the people who are asking for help. I often see posts on Facebook, people saying, hit me up if you put your comment below if you need me to come and help with your phone number, and you think, everyone can see that. So just think about how you're gathering that information and sharing that with others. And I guess, as Emily also said, it's really important that you are looking after yourself and your burnout and your levels of what you can and can't do. Which probably leads me into the next one of mental well-being. And Emily has touched on this a little bit already, but make sure sometimes when we're doing this kind of work, and we're visiting people who haven't seen anyone, or they've been socially isolated for a little while, they probably want to have a chat with you and things like that. And they may tell you stuff that's sad, or shocking to you, or just not something that's in your realm of reality, and it's not something you've ever experienced before. So really self-manage your reaction to the pandemic and how people are feeling. Reflect on your volunteering, your role. Stay in touch with fellow volunteers. If you're volunteering with other organisations, find someone that you trust, that you can talk about how you're feeling. Just look after yourself, I guess, really is what we're saying. And if you think you need help, there's great websites like Beyond Blue and Lifeline, and you can always talk to your doctor, or if you're volunteering for an organisation, talk to your volunteer coordinator. But I guess just look after yourself mentally, because it has been a hard slog for everyone during this pandemic. So, yeah. Anything else to add there, Emily?
I think the last dot point's really relevant. Things as we knew before may temporarily change or permanently change. So the volunteering role as you knew it before really may change. And this is exciting, sometimes some of us don't always cope well with change, but it can be an opportunity. And if we look at it as an opportunity to grow and develop ourselves, but also for the organisation we're volunteering with, it can be really positive. And so maybe if your organisation hasn't before, and you're looking at reconnecting or staying connected as a part of that, ask them, are they offering virtual volunteering opportunities, which might mean you're working or volunteering from home and using your computer. We've heard organisations doing things like rewriting role descriptions and getting volunteers involved in that, or rewriting volunteer handbooks or policies and procedures, and utilising your knowledge and assets as a resource. And the other thing is, maybe you can always suggest ideas like, can our organisation establish a buddy system between our volunteers? So whilst we may not be able to all be back in the workplace just yet, it's actually you and another volunteer are able to connect and check in on how you're travelling, share ideas, think about different ways that you might be able to stay connected. And if your organisation's really open to those ideas, we're encouraging them all to seek volunteers' feedback, aren't we, Rach? So we're really saying to chat to you guys as the volunteers and utilise your knowledge, your assets, and you are a resource. But yeah, don't be afraid to maybe ask them about, how can I help from home? We've had that within our own organisation. They may need to then put things in place like they might need to do an assessment of your work environment at home to ensure it is safe. And they may, as you are going back into the office, they may start asking you to complete some forms as well about your wellbeing or what you are happy to do. Remember, it is a choice. You don't have to give them all that information. You choose what you can give them, and they can't enforce or make you fill that information out. I guess a lot of them are seeking information to make sure, again, it is the most safe environment as possible. But again, back to your rights and responsibilities, that we're encouraging them not to breach privacy or anti-discrimination and equal opportunity legislations. But they may be asking that. So I guess just as a follow-on, things are changing, but it's an opportunity to look at new ideas, new ways of working together, be prepared for some of those forms that might be, or information being, sought from you, but also open to suggest ways to them on how they can connect you in as a volunteer team.
Yeah. Another thing that just is following on from what Emily said is, as organisations start bringing their volunteer programs back on, they may be asking you to have a look at their risk assessments on your role and asking for your feedback. They may be sending you a whole list of things that they need you to do, like clean, wiping down surfaces and washing hands, things like that. And it may seem excessive. And to be honest, Emily and I have seen all our own organisations one, and we're like, that is a lot of stuff to do for us to return to the office. But the organisation is doing it for a reason, and they have to look after their staff. They have to look after their volunteers. So, and this is what the government's asking us to do to keep everyone safe. So, it may seem long, it may seem a bit over the top, but bear with your organisation. They're just trying to do the best they can to keep you and themselves and their organisation safe. So yeah, be kind and compassionate to each other. Is the other thing, I guess, to say, because it is one of those things where you're like, this is over the top, but it is what it is at the moment.
And they don't.
Oh, sorry, I was just going to say the other two things to consider as coming back on, and these are government suggestions, they're not Emily and I's suggestions, is to consider if you need a current flu shot. So some organisations are asking people to have flu shots. I think that was in the aged care sector. People were being asked to have flu shots before they could come back on. So that's something to consider as a volunteer. And the other thing that the government is asking you to consider if you're going back as a volunteer is to participate in the COVID Safe app. You know, the COVID Safe app that you can download onto your smartphone. And we're not saying you have to do it or you shouldn't have to do it, and no one can actually tell you whether you have to have it or not have to have it, but it is something to consider if you're interacting with people. It's a good way to record who you're interacting with.
Absolutely.
Now I'm just going to stop sharing a screen so that we can see if there's any questions. I guess it's kind of at the end of our presentation. But what we want to do is open up, if anyone does have any questions that they'd like to talk to us about, or ask anyone else that we can share, please pop them into the question box. There's none there yet. Or, you know, in the chat, question box is probably the best. But we are open to if anyone has any questions about their volunteering or how they're feeling. Yeah, we're happy to answer any questions that we can for people. So we've got someone from Burnside Hospital there. We've got two from Burnside Hospital. Welcome.
I think we've got quite a few when I looked back through. We've got, someone asking us about developing self-confidence. That's probably, I guess this is specifically around COVID. If that was something people were looking at, you can contact us directly. Some of those really good websites like Beyond Blue and some of those do have different strategies and I guess suggestions on how to build your confidence. But I guess at the moment we're just focusing particularly on COVID. And I guess, you know, confidence is important in this process as well, that you have the confidence to speak up. Or the other thing is, if you're not sure what your organisation's doing in place, or you feel like you're getting some answers that aren't clear, put it in an email and ask for it in writing so that you've got that trail. So, you know, if you've sort of had a phone conversation and you're still feeling uncertain, ask for it to be in writing. There's no harm in that at all. To get that clarity, and you might want to get a friend or a family member to have a look over it as well to make sure that it's something that you're comfortable with. So that might be another one. Oh, look, we can't answer anything specific around who's more prone to COVID, and that's not our role. We're really here today to talk about what you need to consider as a volunteer returning or being involved in organisations. You will need to seek government advice. So if you're in South Australia, SA Health or NT Health for any of that information.
Yeah, we're not experts in COVID-19. You know, we have to do a lot of research to put on sessions like this, but we are experts, I guess, in volunteer management and volunteers. So we don't know. We can't answer questions around the health of, you know, how COVID affects people.
Okay, so there's a question that's come through. Is there any medical recommendations out there regarding volunteers over 70 and if they should or shouldn't be returning to volunteering? And what are Volunteering SA&NT recommending for over 70-year-olds? So we have actually had this discussion as an organisation. At the moment, there's nothing like black and white legislation, but remembering it's about a volunteer being fit and adequate for the role. So there is some work being done around that, and Not-for-Profit Law and Justice Connect are working on a resource to hopefully be releasing, I think this week, isn't it, Rachel, around some of that stuff. Again, you need to go back and check with your insurance, but remember, do not discriminate based on age. We're already hearing that starting to happen, that people are just saying, no, you're in an age bracket. That's not the case, that you can't volunteer, but I think an organisation needs to carefully assess risks. Rachel, do you want to jump in and add on that as well?
Only probably just to agree with what Emily said, if because they are saying people over 65 are in the at higher risk, your organisation needs to make that decision, I guess, and have that discussion. I guess it's the most important point. Have a discussion with the volunteer who wants to volunteer, about where they are health-wise and things like that before you make a decision. We are waiting for that information, hopefully this week, from Justice Connect that is going to cover this kind of topic. But you can't discriminate against someone and say they can't volunteer just because they're over, a certain age limit.
And I guess really from your perspective as a volunteer, thinking about your health and your risks, you really have to manage that yourself. And you can have those, if you're asking that from a volunteer manager's perspective, is just say, we're obviously trying to encourage a safe environment. We want you to, make that judgment, and again, based on all the health guidelines going from the government. But it really, at the moment, there's nothing sort of black and white.
No.
A lot of stuff is around what your organisation's putting in place.
Yeah, so if you're a volunteer and you want to go back to volunteering and you're over the age of 70, I guess you need to do a risk assessment on your own health. And if you don't think that you're at risk, then you need to go and talk to your organisation and list the reasons why you'd like to come back and have that conversation with them or whatever organisation you want to volunteer at. It's a tricky one at the moment.
Because people are trying to do the right thing. But again, if someone's in good health and, they're willing and there and they're able to perform all the duties and functions of that volunteering role, then, why shouldn't they have that opportunity or right to volunteer? Someone's asked about sharing a car when going to events. That again, I guess, you need to think about if that's a personal choice, if you want to be sharing cars. An organisation can't make you. And remembering volunteering is a choice. So, if you're ever uncomfortable or you're not feeling okay about it, as much as you sometimes would like to stay in those organisations, there are other organisations that are constantly advertising and looking to recruit. So if you're ever put in a situation where you're uncomfortable, please don't hesitate. And as someone's mentioned, how do I find volunteering opportunities? You can jump on our website, Volunteering SA&NT or Volunteering NT, to look for one specific to Darwin. But yeah, in terms of sharing a car, I guess again, that comes down, it might be a matter of someone drives and someone sitting in the back seat behind the passenger again, talk to the organisation about what's their policy on that, I think would be really important, and what again you're comfortable to do and not do, and don't be afraid to say it.
I think that's the biggest thing. If you have concerns around your volunteer role, don't be afraid to say it, even if you think I'm going to sound like an idiot or no one else is saying it, or ask the question. Don't just sit there and think, if you're not feeling comfortable with something, ask a question. Don't bottle it up and not ask, or stop volunteering just because you're not sure about it. Ask the question, because most likely if you're worried about it, someone else is worried about it. So it's important to ask that. And maybe the organisation may not have thought about it yet, so it's good that you do raise that so they can think about.
And there's even, I know for some people that might be at the hospitals, I've got friends working in hospitals that their temperatures are being checked every day before you are even allowed to enter the building. So some of these things are such, you're in working or volunteering in such high risk places that it's a matter of that's what, is their policy and what they're putting in place to make sure and maintain the safety of everyone. I noticed there's a few people sort of mentioning, or, from outdoor volunteer groups. We've continued throughout this time to provide volunteering opportunities in the bushfire recovery space as well. So always, the fresh air, people are transporting and getting to that location on their own. So just, again, we've looked at what are the risks, how many people, at each point we've stuck to the government guidelines, so when it couldn't be groups of 10 or more, you know, we've followed every step of the way. So we hope organisations are doing the same as well. Any other questions or things that people would like to ask or highlight or raise? We'll give it a couple of minutes for you to type that in. If not, we probably...
Yeah, we're nearly at the end of our time. So we will send out to everyone who registered today, we'll send you the guidelines that we have drawn up. We'll send you some information about formal and informal volunteering and things to think about as a volunteer. We'll send you your rights and responsibilities as a volunteer. So have a look through those, because I guess they're really important. You do have rights as a volunteer, and there are responsibilities as a volunteer as well. So have a look through those. And if people do have questions after this is over or are looking for volunteer roles, you can always jump on our website, as Emily said. There's a little button up on the left-hand side that says Find Volunteer Roles. You can click on that and it'll give you a whole swag of different roles that are available on there at the moment. Because people are looking for volunteers. Everyone, you know, volunteer roles are coming back. Some never shut down because they're, you know, essential sort of roles that have to happen for the community. So there's that option. Yeah, so that we'll send all that out to you. And of course, Emily and my contact information will be included in that email, so you can always contact us. We're always happy to have a chat and help where we can if you've got any concerns or anything like that. That would be great. And please, if there's any information, any feedback for us or anything you would have liked us to cover that we didn't, please let us know, because we can probably find that information for you and get it out to you as well. The handouts also have some really useful links that you can click on. So as Emily said earlier, and some other bits and pieces that we think that are good for people to have a look at and look at and study up on for your information.
That's right. Doesn't look like any other questions.
No.
Have come through, so we will wind it up then. And thank you for your time today and for coming on board. And we hope to hear from you, you know, or hope that you have success in volunteering going forward. We won't be providing a certificate or anything based on today. This is more about information rather than it ticking any sort of formal recognition. So it's more about informing you as attendees what your rights are and how to help you keep you safe rather than providing a certificate.
Okay, thank you everyone. You can how about you're free to have lunch, go to lunch now a little bit early.
Embrace and keep warm in South Australia and Northern Territorians. Enjoy that beautiful dry season.
Yeah, the dry is beautiful. Thank you, everyone. I hope it was this provided you with some information to help you with your volunteering.
So we will stop recording now, and you can just click leave the meeting, and you'll be able to leave